you so much for joining us for KVUE News at 10. I'm Brian Mays.
And I'm Quita Culpepper. The Delta variant of COVID-19 leading to an ICU alert. Hospitals are running out of room in their intensive care units.
According to state data, we've got just 13 ICU beds left in the central Texas region. 13 beds for more than 2.3 million people. That's the lowest number we've seen since the start of the pandemic last year. Now, to add some context here, it's not just COVID that local medical professionals are dealing with. Just under 8% of all our region's hospital patients are in the hospital with COVID-19.
Tonight, Austin's three largest hospital systems, Ascension Seton, Baylor Scott & White, and St. David's Healthcare, issued a joint statement saying that this spike is putting, quote, extraordinary pressure on hospitals. And they're reiterating pleas to the community to get vaccinated, social distance, and wear masks. And this spike is only adding more stress to local doctors and nurses.
KVUE's Daranesha Herron is live tonight at Family Hospital Systems in Round Rock. And Daranesha, you spoke with the chief medical officer who says they're back to not letting visitors into the emergency room.
Right, and that is making it harder to see the sad reality of what's happening behind those closed doors. That's why I spoke with the ER doctor. He said hospital beds have been so full that he has been treating patients with severe symptoms, and not just COVID patients, but patients with other severe illnesses. He said his fear right now is that soon there will not be enough beds for those who need it. COVID-19 cases surging and ICU bed capacity plummeting to the lowest we've seen since the start of the pandemic. Dr. Nathaniel Greenwood is the chief medical officer of Family Hospital Systems. He says they've had to send patients to Houston and San Antonio.
It's just kind of scary. In my career of practicing emergency medicine for the last 16 years, I've never been in a situation where I call up a hospital and multiple hospitals and I'm told, I'm sorry, we don't have a bed for you. And you call the next one and the same thing and the same thing. It's definitely scary.
The ER doctor says the shortage of nurses isn't helping either. On the plus side, Family Hospital Systems has antibody treatments to help COVID patients recover faster. Dr. Greenwood says this year they've given 198 infusions. 76 of those treatments happened this month.
A lot of our patients who are sick with COVID have not gotten the vaccine. I wish more people would get vaccinated.
This week, Ascension and Baylor Scott & White Hospital Systems announced employees must get the COVID-19 vaccine. Family Hospital Systems hasn't jumped on board just yet.
That's something that we discuss on an everyday basis, whether or not to mandate or not. We do accept that our employees have a choice in the matter.
The CEO and founder of WorkShield, a company that aids in workplace issues, said they've seen a huge increase of not only hospitals, but other business sectors seeking guidance on how to mandate the COVID-19 vaccine.
It ranges construction all the way down to oil and gas and automotive dealers. So let's just say our inbox is full.
And I was really trying to find some positivity in this story. I asked Dr. Greenwood if he sees a light at the end of the tunnel. He says he does. Other countries have gotten over the Delta surge, and we will too. Quita, Brian.
Daranesha Herron live for us in Round Rock tonight. Daranesha, thank you. Now, we spoke with another ER doctor tonight who says a lot of people think that if they've had COVID, they don't need the vaccine. She says that is not the case.